Some of the challenges I see with my students are low self-esteem. Some of them have already tried different types of substances. Some of them are already self-medicating. Some are experiencing signs of depression, and if they're not experiencing those signs of depression, they definitely have some family members and friends that are going through some things.
I was talking with one of our students, and she had a panic attack in my office, and I didn't know what to do. In that moment, I really started to reflect and think about the best ways that I can help the people around me.
During a Teen Mental Health First Aid training, we teach students how to respond, how to connect them to professional help, and also how to keep themselves safe. I started working with Atlantic City High School first. When I found out about the New Jersey Pandemic Relief Initiative, we reached out to one of the principals. Her answer was absolutely, I need it as of yesterday.
We always start our conversations with, you're not going to be a certified therapist, you're not going to be a certified psychologist after this. What your job is to get your friend to the trusted adult and be a friend for them, and be the best friend that you can possible.
One thing about this course that I'm going to take with me is looking for warning signs, asking if they need help, and just listening.
Some of the steps after I've noticed warning signs in my friends is to ask them if they're okay, listen up, and to get them in contact with a trusted adult, or to show them one of your trusted adults if they don't have one.
A lot of what they talk about is self-care, and I think that's something that as a society, and especially in schools, that I think we need to be more aware of, is teaching kids the strategies to manage and cope themselves so they can be better for those around them.
Some tips I learned is how to deal with my own anxiety and just talk and calm down, and how to breathe in certain situations.
iEvolve Experience was fortunate enough to learn about the New Jersey Pandemic Relief Fund from the National Council. With those funds, we were able to provide mental health first aid to over 700 students.
The support that we've gotten through the National Council and the Pandemic Relief Fund has been amazing. Having that larger cohort of other people that were in a similar situation as you were, hearing what their ideas were, how they were going to staff it, who was going to do the training, how they implemented the training or shared the training with, within their community was just helpful, because you never felt like you were by yourself.
This program has been a phenomenal addition to our school, and it's kind of starting to show a little bit more now that these kids are opening up more to us and understanding, hey, mental health is not a stigma anymore. It's actually something that's really important to be talking about at some point.
So as someone who is not only a parent, but I also work in a school, I was also able to see the effect that the training had. There were more students who were coming in with their peers, who were looking for counselors or someone to speak to. And I don't think that they would have done that without the training.
Teen mental health definitely made me feel a lot more comfortable with the school, because it let me know that there are trusted adults on campus.
It works. I've seen the living proof of it. I've had parents, teachers, students write in and tell stories and testimonies of how this training was so effective and so important to their life, and how it saved them from themselves.
I know our district is looking to continue to expand our implementation now that the grant has ceased. But what we have is already about 30 or 40 of our staff members trained in youth mental health first aid. We have 600 students walking around our school right now that are teen mental health first aid certified. And the goal for the district is now to expand this to other staff and other students across our district.